All right. So if you have been a patient here for any amount of time, you will know that we always are talking about the word subluxation. And the word subluxation refers to an abnormal movement of the bones of the spine where they either get stuck or they have reduced movement. And because of that, they affect the function of the spine and the function of the nervous system. So on the left here, you see a spine looking at it from the side. And on the right here, you're seeing what travels inside the spine right here, which is the spinal cord. And from the spinal cord, there are nerves that come out, and you see them right here in red and in blue. These nerves actually go to every piece and part of our body. And you can see all the organs here on the right, showing you the connection between the spinal cord and each part of your body. When the spine is in perfect alignment and function, like we see it right here, these nerves exit the spine and they go to their places where they're supposed to go without any interruption, without any interference, nothing compressing them or causing them a problem. However, when the spine begins to get misaligned and subluxated, then it interferes with the transmission of impulses, nervous impulses that go from the spinal cord and actually ultimately from the brain, because the brain just flows down through the spinal cord into all of these messages traveling, and these messages don't do what they're supposed to do. In moms that are pregnant, we talked about that last week, it causes a lot of problems in the pregnancy and during the birth. In babies, we are going to talk about what those subluxations can cause. So first, I want to give you just some information about how these subluxations can happen, especially in newborns and in infants. And most of the causes of subluxation in infants are pictured right here. The first one is when the baby is not in a good position in the womb. And in this situation here on the picture, you can see how that baby is not head down, which is the normal position where a baby at this level of the pregnancy should be. So if the baby is transverse, which is the case here, or if the baby is breech, meaning that the head is up and the bottom is down, the baby does not have enough space in the womb. And as the baby grows in the last month or so of the pregnancy, when they do the most amount of growing, what happens is that they get very squished. That's not the right word, but they don't fit, and so they start to get compressed, and very often that compression forces parts of their body to go in places that they don't need to be. So their head can go sideways, sometimes their head goes backwards, sometimes their shoulders go one way or another, their hips, their legs, different parts of their bodies start to get twisted around and compressed. And as a result of that, these babies come out with issues. The other reason why babies can get subluxated is during the birth process. And here on the picture on the top right, you can see a baby that is being pulled out of the birth canal with forceps. Here you see a baby that's being pulled through a C-section incision by the hands of the obstetrician pulling on the baby's head. Here on the right, you see a baby that's being pulled by the hands of the obstetrician through a vaginal birth. Both of these cause a lot of trauma to the baby, especially to their neck. In the middle, you see a baby that was a breech presentation, and you can see how they have their little legs bent completely backwards instead of stretched out because of the situations that I was describing earlier. As they start to grow a little bit more causes of subluxations that you see right here is what we call container baby syndrome, and I will speak about this at the end of the talk a lot more. But you can see that all of these different containers that we put our babies into are not conducive to having them earn the position that you are trying to put them in. And this is a concept that I want you to think about a lot with your babies. Babies need to earn the right to sit. They need to earn the right to pull up and stand. You should not force them into those positions before they earn that right. And how they earn that right is by actually doing it themselves. So if your baby is not able to sit on their own, when you take the baby and you try to sit him or her in the middle of your bed, if they flop to one side or the other and they're unable to actually hold the weight of their spine and their body up, they should not be forced into sitting devices like this one, like this one, like this one. So just remember that if your baby is not able to do certain things, you should not force them to do those things. And again, I'll talk more about this later. In all of these pictures, the only one that I want you to think as a good thing is this picture right here of a stroller. This is the right kind of stroller that you should have, not a stroller where you can take the car seat and you can unclick it from your car and then click it onto the wheels in order to now the car seat becoming a stroller. Because if you think about what I just said, when we put babies in car seats, we are forcing them to be in a semi-seated position or even sometimes in a seated position way, way, way before they are ready and their spine is ready for this. And so we are causing them to be in positions that are totally unnatural and that cause trauma to their spine. As you can see, for example, on the low right side of this in this picture, how that baby is totally in a position that is gonna cause a lot of trauma to the spine. Now, how do you know if your baby is subluxated or if there's a possibility? Some of the most common things that happen to babies and the reasons why parents bring babies to us are things that they actually see themselves. So many times moms will bring me a baby and say, I'm noticing this, I'm noticing this, I'm noticing that. And the mom has actually made the diagnosis before I even get to see the baby. And very often they are right on the money. So I'm going to show you and teach you some of those things that you can actually tell if there's something going on with your baby. The first thing is babies that have difficulty nursing very often have subluxations that are caused especially in the top of their neck. And by difficulty nursing, it could be that they nurse much easier on one side than the other, or actually they cannot nurse on one side, but they can on the other. They make clicking noises that sound like like their tongue is just clicking against their palate. They pop on and off the breast frequently. They can't stay on, or they arch their spine backwards. Any of those is what we would consider difficulty nursing. You would feel a lot of those as a very searing pain that you would have on your nipple, which would eventually cause your nipple to crack and to bleed. So if you're getting to those points, you know for sure that there's a very poor latch and that the baby has to be evaluated in different ways, but including something maybe going on with their neck. The next, the next thing that you would notice is that the baby is not very coordinated when you're talking about breathing, sucking, and swallowing. This is a really miraculous thing. Your baby will be able to breathe, suck, swallow, breathe, suck, swallow, breathe, suck, swallow, probably 40 to 60 times per minute without anybody teaching your baby how to do this or anything. They will do it in a very coordinated manner, all because of what the nervous system, the brain controlling all of these different functions on your baby's mouth and throat and neck. But if the baby can't coordinate that, they sometimes gag or they choke, they can't figure out when they're supposed to breathe, when they're supposed to swallow. This is also a possible subluxation. And I will show you in a little bit what happens to how these subluxations occur, not only in the top of the neck, but also in their skull bones. The next thing that you might notice is that the baby has very restricted movements, especially in their neck. This is called torticollis, and you will notice it. For example, the baby will keep their head tilted to one side most of the time, or turned to one side. They have a preference to have their head not in the center, but over to one side more than the other. Because of this, they will tend to develop a flat spot in the back of their head or on the side of their head. And it's because they don't have the movement ability. And so they're constantly looking to the same side, and they're constantly having pressure on their head on the same side. The head, the eyes, or the jaw may seem asymmetrical to you. The one eye may look like it's lower than the other. Their jaw, when they open their mouth, may veer more to one side than the other. All of these are indications that there's something that is not properly aligned, either in the skull, in the facial bones, or in their neck. Here is the picture that I wanted to show you. And on this picture, I want you to see these lines right here between the bones of the skull are actually called sutures. And when the baby is born, these bones actually overlap on top of one another. They kind of fold onto each other and overlap in order to make the size of the skull a little bit smaller, in order for the head to fit through the birth canal. But at the other end, when the baby comes out, slowly those sutures and those bones will start to slide out back into perfect alignment. When a baby has trauma during the birth process, and here's a picture of trauma, forceps are trauma, vacuum extractors are trauma. A lot of times there's inflammation that happens right here in these sutures, and when they overlap each other, they don't come back to normal right away. It takes sometimes days or weeks or months for those sutures to start to come back to their flat state. And these sutures can entrap some of the cranial nerves that are responsible for the suck, breathe, suck, swallow response. And so very often we see babies that are traumatized during the birth process that will have a ridge on the side of the skull, or on the top of the skull, or on the back of the skull, depending on which bone is still overlapped on the other one. More indicators of possible subluxation. A baby who doesn't like tummy time. And at the beginning, there is no baby that likes tummy time. But when you start working with them at about 8 weeks or so, they will slowly gain the strength in their neck that they're supposed to have in order to do tummy time and to lift their head, and it shouldn't be a problem anymore. But if the baby persistently hates to be in tummy time, cannot raise their head, that indicates a problem. When they start to crawl, I don't know how many of you have seen these babies that do a really cute crawl pattern, but it's wrong. It's not a normal thing. Excuse me. And it indicates that there is some problems happening either in the baby's hips or some neurological patterns that are not happening correctly. It's very, very important for a baby to crawl properly, because that creates the connections between the left side of the brain and the right side of the body, and vice versa. So a baby that's not crawling properly needs to be evaluated to see what might be going on, which is a possibility for subluxation. A baby who is always having intestinal issues, colic or reflux or any other gastrointestinal problems, is very often subluxated at the top of their neck or in the mid part of the spine. And we have been able to help so many babies with these kinds of problems. A baby who's very restless, who is not happy, who is crying, who is doesn't settle very easy, who doesn't sleep well, Again, we have been able to help many babies because sometimes it is because they have subluxation patterns that are interfering with the function of their bodies. The same thing with chronic ear infections or chronic colds or respiratory issues. Very often, ear infections are because of not proper drainage of the ear canal. And the ear canal drains because the angle of it goes downward. But sometimes because there's subluxations in the top of the neck, they cause muscle spasms that actually compress the ear canal and are not allowing the normal drainage of fluid from the ears. And so this fluid that just sits there for a long time creates a perfect breeding site for bacteria, which then causes the infections. Some things that you can see that are visual. Here's a baby that has a flat head, and that's what I was talking about when they have torticollis, when they have restricted movement in their neck. There's constant pressure against the same spot in their head, and you will start to see a flat head. Here's a babies that have problems with their sacrum or with their hips. They will exhibit a V shape or a deviated line. So this is if you were pulling their diaper down, this is what you would see between their cheeks. When they start to walk, you will see that their toes go in or their toes go out. A lot of times this is not a problem in their feet. This is actually a problem in their hips. And here's one of the babies that we took care of. And here's an example of what torticollis looks like, where her head is actually stuck completely to the side. And yes, we were able to help her. Here she is after we were done taking care of her. But many of these things could have been avoided. She was born with forceps, so the forceps caused the trauma to her neck. But the mom probably had some issues with her positioning during birth, or with the alignment of her pelvis, which is what might have precipitated this baby needing to be pulled with forceps. Now, we have also our own ways of diagnosing these babies, and having the baby hanging is one of the easiest ways to diagnose babies that have subluxations. You can see patterns in their hips, you can see patterns in their shoulders, you can see patterns in their heads, and your babies will be hanging, not hanging, but they will be upside down in your womb for the last couple of months of the pregnancy. So this is not an unusual position for them, and it is not a dangerous position. We only hang them like this for maybe 5 to 10 seconds to observe, and it's one of the best diagnostic tests that we can do with babies. We also palpate babies, and here you can see my fingers running up and down this baby's spine, feeling for each and every one of the little bones on their spine to see if they feel out of alignment, if the muscles feel tighter on one side than the other. And the next question is, when should babies get checked? So, to all of the patients who are with us during their pregnancies, we tell them that we want to check the baby as soon as possible after the birth. Because if there was any problem in the womb, if there was any problem during the birth, we can analyze the problem and correct it the sooner the better. Because the longer that a subluxation stays in the spine, the more problems it will cause to the function of the body. And so most of our patients get their babies checked right away. The first visit, that when you come back after your birth, that's when we like to schedule the baby for their examination. And as a gift to our patients who are here on their care plan for pregnancy and postpartum care, the examination of the baby is our birthday present to them. There are also other parameters that we use to determine if the baby also might be able to get some free care as part of the mom's care, but we will discuss that with each of you depending on when you started your care, and other different factors. But ideally, you would get the baby checked as soon as possible after birth. Sometimes I go to your births, and if you're having your birth at home or if you're having your birth in a birth center, I love to go to births and adjust you during labor, and then adjust you when the baby is out, and adjust the baby as well. But short of that, for moms who are not our patients, we always really stress that babies that are born through a C-section or that have any kind of trauma or interventions during the birth process need to be checked. Ideally, I would love for a chiropractor to be in every birth, because we could make things so much easier for the mom having this baby and also for the baby. Because even under perfect circumstances, babies sometimes have trauma during the birth process. When the baby starts to pick up their head while they're on tummy time, that is a really important time to get checked, to make sure that they are lifting their head properly and not leaning the head sideways to one side or the other. When the baby begins to sit, that's another perfect time to get checked, to make sure that they are sitting in a straight manner with their spine in perfect posture. And they start to crawl, so that we can make sure that they're crawling in a perfect pattern, and not like some of these other babies that scooch or that have their leg out while one leg crawls properly, the other leg drags, or things like that. When they start to walk, because they will fall a million times when they're learning to walk, and when they fall on their bottom, that impact actually reverberates all the way up their spine, and it can cause subluxations all the way up into their neck. If you're vaccinating your babies, we recommend that they get checked immediately after a vaccination, because we see a vaccination as something that's traumatic chemically for the body, and that can also cause subluxations. If the baby falls or has any kind of trauma, whether falling from the changing table, rolling down, rolling off your bed, when they start to climb to the kitchen counters and they fall, anytime there's a fall like that, they need to be checked. If the baby has a tongue or a lip tie and you're planning to do a revision, it is really, really helpful to start to have these babies worked on before the revision, so that they have the most amount of relaxation and the revision can be done as best as possible. And then after the release or the revision, we also advise that the babies get checked. Most pediatric dentists will actually recommend that you see what they call a body worker. And we are in that category of body workers, as are craniosacral therapists and massage therapists that specialize in baby issues. If the baby has chronic respiratory ear infections, or also gastrointestinal issues. And as a rule, once a month checkups are recommended for babies, other than the issues that we just listed above. Let's talk a little bit about tummy time and what I was referring to earlier as container baby syndrome. If you did not have any containers to put your babies into, and a container is anything ranging from a car seat to a stroller to a swing to a bumbo seat. I can't remember the name, but that little cushiony chair that you sit a baby before they're ready to sit. So think about this. If you didn't have any containers, what would babies be doing? They would actually be lying flat in a horizontal position, and they would be able to move around, to open their arms completely, to stretch their legs completely, to start moving around into the rolling positions. Then they would be able to roll over. They would start to lift their head. They would start to push up on their arms. They would start the crawling movements, and then they would sit. Then they would start to pull up, and then they would walk. What container baby syndrome is is this new thing that has been now named. It's a problem that is now a named condition, where babies are being put into too many containers, and this is interfering with their normal neurological development. And that's because if your baby is always tied down with straps around them, they don't have enough mobility to be able to get into all of these positions that I just discussed. And believe it or not, the physical milestones that your baby has to go through are also equivalent to neurological milestones that these babies have to go through. There are windows of time where this neurological development is happening. And when babies are in containers that keep them from being able to do the things that I just mentioned, then they miss out on these different neurological windows. So the first job that a baby has in their lifetime is to gracefully go from being horizontal to being vertical. And it takes them about 1 year to do that. And you can help this process immensely by not putting them into containers. The only container that I'm going to say you have to put them in is the car seat, because by law you can't have a baby not in a car seat. But the car seat needs to be just for the car. You do not want to bring the car seat into the places that you're going in for the day. You don't want to bring the car seat with the baby in it into the supermarket and just put it in the cart, or into your appointments and then just put the baby's car seat on the floor, and that baby never really leaves the car seat. The baby actually stays in that car seat for hours sometimes. So try to keep your baby in the car seat only from when you're going from point A to point B. If you have to bring the baby somewhere with you, have a stroller that is horizontal and put the baby in the stroller so that the baby can be horizontal and can have enough space to just do what they need to do, to expand their arms, expand their legs, and have all the mobility that they need to have.